Terri, I really appreciate you coming to the office today. You're actually just visiting San Francisco, which we'll get to in a little bit, but you're a patient of mine dating back to January of last year. Can you speak a little bit to what your life was like at that point in time and your history with your headaches?
Right. I began getting headaches bad headaches on the right side in 2015, completely debilitating. I was down for like at least 2 days with each event. I was misdiagnosed twice. I was finally properly diagnosed in 2017. They began doing radio frequency ablations just on the right side. Those would work for anywhere from 4 months to 9 months, typically. I got about 100% relief. But I also had to do physical therapy per the insurance requirement. And when I would drive home from physical therapy, that's when the really bad bilateral occipital neuralgia symptoms would start. And by the time I would drive home, I was just done. I couldn't function. I started nerve blocks. And the nerve blocks were always hit or miss. So the pattern became, I would get the ablation, be okay. I would get nerve blocks close in time to that, and I would be able to function and start to exercise again. Just household things like picking up laundry, going up and down the stairs, typical day-to-day things, driving. But as soon as those wore off, I would be like a month to 2 months downtime where I couldn't do anything until the next treatment. So any progress that I made in getting back in shape was just negated by those so it was a cycle of that.
A lot of back and forth.
Right. And over time, there were the triggers that would cause it became worse, and more things would trigger it. It was like a gradual snowball as far as I just couldn't get back into shape. And so it was just years of that pattern, and I was out of shape. I was starting to get other symptoms like, age-related heart issues, high blood pressure, just, the thing, and there didn't seem to be support-wise. I knew there were patient support groups for it, which I found, I just stumbled onto them. But the actual treatments I didn't feel like I had like a care plan in place. It was just call us when it wears off.
Have some pain, right.
Right.
And you tried all sorts of medications as well.
Yeah, for home remedies. Home remedies were, I bought some physical therapy devices that you would lay on and the special pillows. I had Excedrin migraine, Benadryl, topical creams, gosh, so many things. Nothing really clicked, or one thing would work one time, but then it wouldn't work the next time.
And prescription medications?
Yes, prescriptions. I was on 2 different muscle relaxers, amitriptyline, gabapentin. Amitriptyline worked for about a year, and it stopped working. Tizanidine, I think, when it's a muscle relaxer, worked for about a year, stopped working. Gabapentin never worked. When the gabapentin didn't work at all, I tried it for like 3 months. My primary care physician said, well, that's all we have for you. There's nothing else. There's just nothing else out there. I found the surgery just through a Facebook patient support group. Your name was you were the only surgeon that you could find on an online search. Later, when I joined Reddit, I saw other surgeons. But I called the Mayo Clinic in Minnesota because it would have been an easier drive than flying out here, right?
For sure.
Right. Gave them the whole written explanation of my symptoms. Within 1 day, the neurology department sent me an email back saying, no, you're being treated sufficiently. Which, right. So it just feels like there is a lot of support out there if you know how to find it.
Fortunately, it's still pretty hard to find.
Right.
Despite a lot of people yelling from the rooftops. So,
right.
Yeah, no, I'm sorry you had that experience. But then when we met, which was about 15 months ago,
Right.
We determined that it was probably 6 nerves in the back of your head, 3 on each side, that were causing the symptoms. We operated on all 6 of those nerves literally 13 months ago, almost to the day.
Right.
Talk a little bit about what the operative experience was like and the time around surgery.
Fantastic overall. Up until 6 months ago, I was putting it at about 80, if you have to put a number on it, 80 to 85% successful. I could do all the things again, like we could make plans, I could do grocery shopping, I could do the housework. It was great. Every once in a while I would overdo it and I would feel some irritation, and I would just lie down on the heating pad or just take it easy for a day or two. The nerves kind of calmed down, but it felt more like muscle tension. What I've noticed after the 6-month period, now that I'm exercising again consistently,
Which is great.
which is fantastic, I'm able to get my muscle strength back, which also obviously helps with the posture.
Yeah.
So as long as I do the stretches and watch my posture and exercise, I'm fine. It's not an exaggeration to say that I got my life back.
That's so great to hear. What about all those medications you were on?
I have not been on any medications, not prescriptions. Every once in a while I'll take ibuprofen if I start to feel like the muscle tension is starting to bother me.
Yeah.
So, but what I've also noticed is prior to the surgery, your brain is constantly being hit with the pain signals. So you lose touch with being able to identify my shoulder hurts, and it's because I did so and so. If I lie down, it'll be fine. Or I have muscle tension, but I couldn't identify them. I couldn't separate the muscle tension from the occipital neuralgia because that was the worst. Now I can say, well, it is muscle tension, or I'm old. I'm old and I've got some aches and pains, but I can separate it, and I can identify. I've got a little bit of nerve irritation, like little pin pricks, but I'm also not having that immediate, psychological reaction of just stiffening up and preparing for the worst. Right. Now I can, great example, yesterday we walked all over Golden Gate Park. I felt a little bit of muscle tension, a little bit of irritation. We walked for about an hour and it went away. And so, where they say exercise can heal you, exercise is great for you, I'm finally seeing those benefits. Yeah. And so, it's like I said, it's not an exaggeration to say I got my life back.
Well, I really appreciate you saying that, and I think it sort of brings me to what I was going to say. You guys are here not because you came to the doctor's office. I dragged you in here and you were kind enough to come, but you're actually visiting the Bay Area
as tourists.
For fun. Yeah.
Yep.
So
Yeah.
that's
Yeah.
Well, listen, I really appreciate you taking time out of your vacation to come here.
Glad to do it.
Telling other people your story. I think it's really going to help a lot of other people, and I think all the points that you raised are so critical, like when you don't have that constant screaming of pain signals, which drowns out everything else, it all gets lost in the morass. Now when you have the occasional aches and pains, the shoulder, the stiffness here, which I agree with you, I have that a lot as I've been aging myself, and I take ibuprofen every so often also, but I think you're able to not only perceive those things differently but react to them differently.
Right.
Because it's not, oh my gosh.
Right.
What's going to happen next?
Exactly.
So,
right.
It's really great. Well, thank you so much, and it's been such a pleasure to treat you.
Thank you so much. The whole experience has been fantastic. No complaints.
All right. Go enjoy your vacation.
We will. Thank you.
All right.